And hello and welcome. My name is Ryan Belmore. I am the owner and editor of What's Up Noop. And because myself, as well as my guests, are already logged on and ready to go here, we're going to make the best use of everybody's time and get started right here. My guest today is Dr. James McDonald. He's with the Rhode Island Department of Health. He has served at the Rhode Island Department of Health since 2012 as the Chief Administrative Officer of the Board of Medical Licensure and Discipline in the Center for Customer Service Medical Director. First of all, Dr. McDonald, thank you for joining me, but your business card is quite long.
Hey, Ryan, thank you for having me. My business card is long, and it's funny you say that. I actually think business cards, are they going to exist? I mean, as we think about how the pandemic's going to go, I wonder if business cards are going to go the way of the dodo. I just wonder.
Yeah, and I don't know if they will exist. And we are talking to you. I am in Newport today. And I was doing a little reading today, and you've got a little history down here in Newport.
I did. It's interesting. The Department of Defense brought me to Rhode Island. I got to work for the Navy. I was there from 2008 to 2012. It was great. Director of Health Services for all the Navy clinics in New England. It was super. It's just that when I saw this opportunity show up at the Department of Health, I was like, well, that looks kind of interesting to me. So we made the hard decision of leaving the Navy as a civilian, going to work for the Department of Health, and I've been there a little over 8 years now, and I enjoy it. It's a fun place to work at the Department of Health. It's not as fun lately, though. I will say that longer days, a lot going on. The weight of the pandemic is definitely noticeable.
Yes, and people may recognize you from your Sunday appearances with Governor Raimondo over the last couple of weeks. At one of those appearances recently, Dr. Nicole Alexander Scott mentioned that you had to get tested for COVID. Why don't you give us a little about that experience and what the test is like?
Yeah, sure. So it's interesting. I actually work mostly from home, but in my office suite at the Department of Health, I was there one day, and there was some people in my office suite who had, tested positive. So there was a recommendation made for everybody to get tested, whether you work there during the day or not. So I, just wanted to be a good soldier. Went up to the Twin River site where CVS was, and I got the nasal swab done. And when I say the nasal swab, the CVS Twin River site does the anterior tip in your nose, you twirl it around 5 times, and they do the Abbott ID Now test. So I found out that Saturday morning I was negative. And then just to keep everything going and thorough, we did follow-up testing about a week later at the Department of Health, and I was negative again. So it was just one of those things where that was the nasopharyngeal swab, where the Q-tip goes all the way in the back of your nose. That's a lot more uncomfortable. But then we were able to find out that as well. And I think part of what I saw with that was, for a couple of things. One, a lot of the people who had it at the Department of Health were really pretty much asymptomatic. And it really reminded me of how mild this disease can be for people. In other words, if we were not looking for the disease, we would not have found it. But that's important. And the reason I just say it's important is if we don't do the case finding, in other words, find everybody who has it, then we don't isolate them, then we don't quarantine those who are exposed, and then we don't really have a good picture of the pandemic. So I was negative. I actually was not quarantined. I was never sick. I have to tell you this, Orion, it was kind of funny. I can't tell you how many emails I got from people saying, gee, hope you're doing well. Thoughts and prayers. We're pulling for you. And I responded to each and every one who did that saying, I'm fine. I really didn't have any problems at all. And really, the director covered for me that Saturday on the press conference more so because I just couldn't get back in time. And I just said, this is going to be hard to make this work. So she was like, well, I'm here. I'll just do it. I said, that'd be great.
Yeah. Well, I figured we'd touch base on that, seeing this might be your first public experience since then. Speaking of information and data, we kind of get hit sideswiped with data and information every single day. And, I have the Rhode Island Department of Health COVID-19 data tracker right up in front of me right now. When you wake up every morning or when you're enjoying lunch, what is the one number that you are looking for and Rhode Islanders should look at each day, should focus on? There's a million numbers on this page. What should I be looking at to know how we're doing?
I look at the hospitalizations. To me, that's the number that to me is the most telling for me. And the reason why I look at hospitalizations, I look at the number of cases first. That's almost always, though, a product of how many tests we did that day. And so we might get a % positive day. But in other words, the more tests we get done, we might find more cases. Lately, we're seeing the % positive drop, which is encouraging to me. When you look at the number of hospitalizations, though, The reason why that's the number that matters to me is when you think about why are we doing everything we're doing, it's for a lot of reasons, not the least of which is we don't want people to pass away. We don't want people to suffer morbidity. We're really worried a lot about hospital surge. And what I mean by hospital surge is we didn't want the hospitals to get overwhelmed, because it's bad enough if people get this illness, and it's bad enough if people have problems with it. But what we didn't want to happen was what happened in Italy and what happened in Wuhan, China, and to some degree happened in New York City, which is that people passed away from this pandemic who didn't need to. They just couldn't get a ventilator. And that was a tragedy beyond compare. And like one of the things we had to look at was some very difficult decisions about how do we manage this pandemic so that people have all the resources we need. And it was a difficult time because we really found ourselves competing with 49 other states to acquire the same critical instruments that everybody else needed. Now, we've survived the surge so far. We're keeping close on it because I don't want to create the impression that we're out of the woods at all, because we're not. We still have to keep track of this every day. And I'll say this too, Ryan, I think 24 hours is a very long time in the pandemic. So I don't make any conversation, besides just the day I'm dealing with. I stay very much in the present with the pandemic because there's so much going on. But the hospitalization data is the thing that I look at the most, because I think it's most telling about where we are.
And for those, I just pulled it up on the screen, but yesterday there was 1840 tested, and 247 are currently hospitalized, with 59 in ICU, 44 on ventilator, and 26 new fatalities. And just for a quick recap, because people might see that number, Director of Health mentioned today that some of those did happen prior to yesterday. So they did not all happen on yesterday. They were kind of just how data works, I guess.
Yeah, Ryan, part of what we're getting to is how does data get reported to the Department of Health? And so, one of the things about when folks pass away, and this is always a tragedy, just, when I just see these numbers every day, that's the one that makes me stop. The first one I look at is hospitalizations. The one that always makes me stop and say, oh my gosh, is the fatalities, because that's always one person. It's always a family. It's oh my gosh, it's a big deal. And I think that when you think about fatalities, when we're getting this data, whether it's from a hospital or a nursing home or somewhere else, the first thing they are doing is taking care of the family. Then they're taking care of administrative things, and eventually they report the data to us. So there might be a lag in that from a period of time. So it does come in sometimes in bunches from different facilities. So that's why sometimes the numbers seem to be a little higher some days than others.
Yeah, and 532 Rhode Islanders, unfortunately, and among the COVID-19 associated fatalities here in the state, and those are moms, dads, brothers, sisters, grandmothers, grandfathers, and that is, 1 is a lot, but 532 is certainly a number that takes your breath away.
Yeah, it really does, and I think it really speaks to the power of this virus. One of the things we've talked about on the press conference is the SARS-CoV-2 virus. It's actually perfectly suited to cause a pandemic because it's transmissible enough that people get it from one person to the other, but it's got the morbidity and the mortality. In other words, it puts a lot of people in the hospital and it takes lives. And that's why it became a pandemic and why it got our attention. Because had it just been as mild like a cold, and we all would have gotten better from it, and there was a lower fatality rate than other known viral diseases, it wouldn't have really garnered as much attention or really as much resources. But it's really the power of the virus and how it really destroys us. And one of the things that I think we forget sometimes is, what does the acronym SARS-CoV-2 stand for? And it's Severe Acute Respiratory Syndrome. And Ryan, the point I want to make there is syndrome. It's not just a lung disease. We're learning more and more about the virus, but it affects your kidneys. It affects other organs. It affects your blood clotting system. And we're seeing part of why people succumb to this is end organ damage. In other words, it wasn't just their lungs, although the lungs are really what do end up being the last problem for most people. The other organs getting damaged as well is really quite problematic as well. And it's this syndrome to it. And syndrome just simply means a group of symptoms that I think we're really having to understand even more. And one of the things I just want to highlight is the SARS-CoV-2 virus causes inflammation. And the inflammation is what damages all the tissue. And think about it this way, Ryan. All of us have sprained our ankle at one point in our life, right? You sprain your ankle, you put some ice on it, you take some Motrin, you elevate it, you're better in a couple of days. Maybe you go to the physical therapist, but it's not a big deal. But when you have inflammation in such a broad, diffuse manner throughout your whole body, starting in your blood vessels and in your lung tissue, it really does cause a lot of havoc. And that's part of why a medicine to treat this is really critical. We really need some medication to control all of this and, hopefully kill the virus. And then we really need a vaccine to really help prevent this as well. And, right now we don't have either. There's a medicine that's okay, the remdesivir, but you have to be in the hospital to get it. The vaccine is still quite a long ways away. And that's one of the things that I worry about. We have to manage this pandemic well enough to get to the point where we have not just a good vaccine, but enough people get the vaccine so we do get true herd immunity. And we don't even know that that's going to happen. I don't speak about a vaccine coming with certainty. What I'm hoping is science will provide that. I hear the same things everybody else hears about it, but I'm waiting to see if we actually get one of those. I'm hoping. We're waiting to see.
Only because you're on the medicine kick, and I think anytime I have a medical professional on, I should try to help point the direction or clarity any way I can. Obviously, the big news yesterday, hydroxychloroquine. President Trump said he was taking it. What should people know about that? And do you recommend anybody else taking that medicine?
Yeah, so hydroxychloroquine is the generic name. Plaquenil is the brand name. And the one thing I want to get out first, though, is hydroxychloroquine is really important for some people who have rheumatoid arthritis or some people have lupus. Those folks need the medicine. And so we want to make sure those folks have the supply of medicine they need. There's been a fair amount of research on hydroxychloroquine, and it has not shown that it's been effective at preventing death or preventing hospitalization or preventing people going on a ventilator. And those are in pretty good studies right now. So we're not seeing anything positive right now showing us that response. What the president is doing is taking it to prevent an infection, and there's no literature to say that is effective as well. So from my point of view, for me, like if you're asking me, would I be taking hydroxychloroquine every day? The answer is no, I would not. And the reason I would not is because side effects, that's one thing. And some of the side effects can be problematic. They can affect your heart, also your vision. But the other thing is, I really don't want to be taking a medicine that somebody else needs. And that's just the way I am. In other words, I know that there's a limited supply of everything on the planet. So I don't want to be taking things that other people need. And quite frankly, I think we have to be very careful. And one of the things that I think I worry about sometimes is, where does our mind take us during a pandemic? Because, if you look at just what's going on in the pandemic, it's very easy for our mind to go down a path of fear and catastrophic thinking and just getting into that space. And, I don't mean to quote Star Wars, but why not, right? In other words, there is a path to the dark side. And I think there's sort of a little bit of point in that humor there, which is that we don't have to go down the path to the dark side and get stuck in fear and catastrophic thinking. We have to stay present in the moment. I know there's things I can do to prevent me from getting COVID-19. I can wear my mask. I can wash my hands. I can keep people arm's length away. These are things I know I can do. And those work. They work pretty well. And part of why I'm getting out there is what I'm focusing on doing is, what do I know works? And what I'm not going to do is I'm not going to walk down the path of desperation and try things that really don't have any evidence to feel like they're going to work and do present risk. And I think that's just an important message for everyone who's listening is that, I really would prefer you just think this a little bit. Focus on what you know works and do that well. And I think you end up in a better place than being desperate towards ideas that may not have been tested yet.
We are unbelievably only 2 months into this, just about since when everything kind of got shut down. And just to remind people, that was to flatten the curve, that was get the hospitals ready, that was to get, but what are some of the things now, 2 months later, or what is the biggest surprise now, now that you've had 2 months of research and living with this pandemic?
So a couple things jump to mind. One of the things that I just will say is I'm track of this every day since patient number 1 to set context for myself. So it's day 80 today since patient number 1 was diagnosed. And, my life has been completely turned upside down since that. So to me, it reminds me of when I was working in medical school and residency, because now I work every day, 12 hours a day. And it's okay. I don't mind doing that. It's a pandemic. That's what I have to do. One of the things we didn't know then, though, if you remember back when this first started, we didn't know there was person-to-person transmission. Now, when we first heard about the virus in China, it was like, well, it was thought that it was animals to humans. And that was like, okay, well, that's not going to happen very likely. And we learned, well, it was only in January we learned, no, there's person-to-person transmission. And something we learned from a case in the United States. So that was really a big deal to learn that. And when that got everyone's attention, because once we realized there was person-to-person transmission, we knew, well, this really could be quite a problem for us. The other big reveal to me was only about a month ago, maybe about 5-6 weeks ago, we learned there was asymptomatic transmission. And asymptomatic transmission means well people can transmit the virus. And we're still trying to understand how big a factor that is. But to me, that's still a big issue. And that's when we made the masking requirement something we started putting a lot of emphasis on. I think that was big. I think to me, one of the big unknowns in the pandemic right now that's still a big unknown is children. In other words, we're most typically used to children being super spreaders of viral infections. At least that's our understanding of influenza. But we don't have that evidence yet with the COVID-19 disease and the SARS-CoV-2 virus. In other words, we don't know really what's going on with children. When I look at our data, only 2% of our cases so far have been in people age 0 to 9 years old. So that's interesting. Only 2% of the cases are in kids right now under 10 years old. So we're still studying that as a world, not just as a country and as a state, but as a planet, trying to understand what does that mean that kids aren't getting it. We have our ideas that maybe the kids just don't have they don't get infected as much, but it just starts to raise a lot of questions. And then the possibility exists that, well, maybe kids are getting it, but it's so mild in them that we're not knowing they have it and they are spreading it. So it's still an unknown question to me. So I think the biggest reveal was the asymptomatic spread. I think the biggest question right now is, what is the role in children? We just don't know yet.
Yeah. Just one of the, we're going to do this from a health point of view, but one of the things I hear most and read most in our comments is, well, it's only old people and it's only people at nursing homes that are dying and that are getting sick. Let's just open everything up. And it's kind of the herd immunity approach. But, what do you say to that? That there are people outside of nursing homes that are getting sick and dying.
Yeah, there are. And I think, I think you have to separate what's news from what's evidence. And I think one of the ways I think about this is when you look at who gets affected the most by the pandemic right now, it isn't just the elderly. It's people who live close together. We've seen far more penetration of the disease in people of color in Rhode Island, and people of lower socioeconomic status. And that's very concerning to me and to the Department of Health. I worry about that. And I think one of the things we have to be cognizant of is there's way too many unknowns right now to just open everything up because we still aren't designed to handle any kind of major surge. And one of the things to throw out there is we don't have a vaccine yet. So we don't have a way of controlling this. We don't even have a meaningful treatment yet. So we don't have any way of treating this yet. And by the way, there's still a fairly large number of unknowns. One of the things that I wonder about sometimes is this is the virus we know right now. But the more people who get the disease, the more you have to wonder, will the virus mutate or change over time? And then what else do we get and is it worse? And so there's a reason why everybody's being very thoughtful about our management of this is it doesn't affect everybody the same. And there is a disproportionate effect on the lower socioeconomic status, the people of color, and quite frankly, the elderly. And it's not just those, it's those who have underlying medical problems as well. I think one of the messages we need to take away from this whole is, we would be better off if we were a little bit leaner as a people and a little bit less with some of those other medical problems. Like if we had less type 2 diabetes, less hypertension, less metabolic syndrome, less people who were smoking, less people with other diseases that put us at higher risk for this, we would have been better prepared as a country in that regard. And I think those are hard though, because it's hard to take those chronic diseases away and they get better with a lot of time and energy and help. But these are things that put us at higher risk as a country. I think it's part of why we're struggling with it the way we are.
How hard is it as a doctor in knowing a lot more about health than the average person to look at the data and also see that we have to reopen the economy and try to balance those two things of, yes, we need to open these businesses, but there are still people going to get sick, and that's going to be the toughest balance out of all of this.
Well, I think you raised an interesting point. I mean, obviously, as a physician and a public health physician, one of the things I know is one of the most powerful public health interventions you can do for anybody is a job with healthcare benefits. Because a job with healthcare benefits really does help people to have a healthier life. And we do have to have an economy that percolates along and runs. People need jobs. We need to be able to pay our bills. All of us have to deal with the mortgage, the rent, call it what you will. And the balance is, how do we do this in a way that actually keeps us healthy? I think what I'm seeing, though, as I look at the plan together is when you look at the work streams, and there are many, there's a lot of policies coming out so that when you want to go back to the doctor, it's different now than it used to be. Like when you go into your doctor's waiting room right now, you shouldn't be sitting next to a stranger. You shouldn't be sitting next to anybody. You should be 6 feet apart from someone else. When you go into your doctor's office nowadays, you're going to see someone wearing a mask, and it isn't just you, it's everybody else. This is some of the difference we're going to see everywhere we go, though, Ryan. Like, in other words, if you get to a restaurant, you're going to see, unless you're dining, people are wearing masks and being 6 feet apart, and the tables are farther apart. And I think how we look at all these events are going to be different for a long time. And I kind of joked earlier about business cards, but I think some of our behaviors are going to change too. Like, it's interesting. The handshake was a cultural norm of ours for so many years. I mean, the handshake came out from, I believe, somewhere in the 1100s, and it was a medieval tradition to show your right hand to show you didn't have a weapon in your hand. I mean, it was kind of an odd tradition to really get right down to it. Why are we shaking hands with each other? And the reality of it is, that's a cultural norm. As far as I'm concerned, it's okay if it goes away. Like, I don't really need to shake other people's hands to greet them. What I can do is I can wave, and that works. But no germs are transmitted with me waving. But I think the other thing that's going to be part of a cultural norm is people wearing masks when they're out in public. And I think that's going to be a cultural norm for a long time. And then the other thing I kind of joked about earlier was, sharing tokens with each other, like little business cards. Why do we even do that anymore in this era of electronics? It's one more place where you're going to spread germs, but it's also like, why waste the paper anymore? It's just like, what's that all about? And I think part of what we're all learning is, how are we going to do life differently? And I think that's the balance that I'm more optimistic about. And so when I'm working in health policy for the state, what I'm looking is how a need to be an economy, a need to work, a need to play, by the way, too. We all need to play. And then how do we actually do it and stay healthy? Because if we can balance work, play, recreation, family, spirituality, the whole life, that's the whole package. That's what I'm trying to put together so we can do it all.
How much is, we're hearing about phase one. The governor announced, if anybody missed it, that she's expecting on Friday to announce hopefully plans for phase two. How much is this testing the water a little bit, because we don't know what's going to happen or how the disease is or how it's going to spread? You mentioned children earlier. And how much is it looking at science and, the 6 foot rule or that you've demonstrated with the governor and things like that, where you're using science or you're using the unknown and being very safe with the unknown?
Yeah, and evidence and science is a lot of what our decisions are based on. And really that has to do with decision making, because otherwise it just gets emotional and then it gets weird really quickly, and weird doesn't help anybody. And part of what I'm getting at is, when you look at where we're going for phase two, and I'm going to be learning when that is, just when you are as well. I mean, I have ideas, but I'll learn sure when you will learn. But part of what we're getting to is, how do we expand things responsibly so we can balance work, life, recreation, everything we need to do, but yet do it in a manner that's responsible and safe. One of the key things is, there's risk to everything we do. We know there's risk, but there's risk to keeping everything closed and risk to opening up like crazy. One of the things I'm very, comforted about is, I'm surrounded by a lot of really smart people, no longer around tables because we don't have conference rooms anymore, but through a lot of video chatting and a lot of email and a lot of just phone calls, about a lot of smart people making really responsible decisions. And the people I'm working with get it. We have to find a way to balance this whole pandemic so that we can live our lives. Rhode Island is different than other states. So much of our economy depends on tourism. So we have to find a way to make Rhode Island still a safe place to visit. And part of tourism is making sure people feel welcome. And we have to make sure that people feel welcome. And one of the things that I think is important that we did is actually brand a little bit about how businesses can make sure their consumers feel welcome. So I did a lot of work with Secretary Pryor and working with reopeningri.com about how do you make it so your business has actually got a checklist. You can put a little sign on your window that says, I did the things to make my business as safe as possible. Because quite frankly, as a consumer these days, if I see that sign in the window, at least I have cognizance that the owner got it and wanted to balance my safety, because I want to shop Rhode Island. I do. I want to find the stuff I need here.
I have had a lot of people on. I had a lieutenant governor last week, as well as Evan Smith from Discover Newport. We're calling this summer Rediscover RI. You make a bucket list of 20 things you want to do in the summer of 2020 and go out there and rediscover what's in your backyard that you may have been too busy doing. Do you think we'll be able to have domestic travelers or international travelers anytime soon?
I hope so. I mean, I think to some degree it's something we're still discussing. You know, part of what it is that we have to balance is what's the disease look like in other parts of the country and other parts of the world. And today, you still see a fair amount of activity in a lot of places. So we're not ready for that today. But as the disease changes over time, I mean, one of the things that's going on now that wasn't going on over 80 days ago was every state in the country has a monitoring system and is tracking this. And all the countries are tracking it as well. So we have a lot more data, a lot more transparency. And I think as a planet, you know, one of the things that, you know, I get is, at least as a planet, this is one thing we all are, we want to be careful about what we do to other people. So we're careful about how we travel. And I think we look at travel a little bit differently than we used to. I think right now, one of the things that I think we think about is like, if I travel from point A to point B, what do I need to do differently to get there without putting myself at risk for getting a disease? And, you know, I think we changed a little bit, like, well, do I drive instead of fly? And if I'm going to drive, how do I target my rest stops? I'm strategic about that. And when I drive, do I have my personal protective equipment with me? Do I have my mask on and, you know, am I ready with my hand sanitizer? Because, you know, I'm going to go guess that most of us when we travel didn't used to have hand sanitizer in our car. But now I think we probably do try to say, well, I got to make sure I got my hand sanitizer ready.
And overall, I'm sure as, you know, a doctor, you're not just preventing COVID-19, you're preventing a wide variety of other diseases and sicknesses that you might catch during those phases. Overall, it's a good health decision.
Well, these are, a lot of the viruses travel in the same way. So I think one of the things we're seeing across the state is not only are we seeing less people getting sick with COVID, but we're actually seeing less people getting sick with everything. You know, one of the things I look at every day is a chart that shows me the emergency department visits across the state. And, you know, one of the things I've noticed is the emergency departments for the last 8-9 weeks have had lower volumes than normal. Now, that's probably a good thing. Of course, I worry about things. So one of the things I worry about is, are there people who should be going to the emergency room who aren't? I know doctors' visits are down too, and that might be a good thing. But the other thing I worry about is, are there folks who should be going to the doctor who are not going? And, you know, one of the things that did worry me is our vaccination rates for April and March of 2020 are much lower than April and March of 19. I think to some degree that's concerning. I'm not worried about us losing herd immunity with those childhood preventable diseases yet. However, we need to catch up. And I think, you know, one message for folks is, if you have gotten your vaccinations for your kids because you're worried about going to the doctor, I can assure you your doctor is taking precautions to keep you safe, and you're safe going to your doctor's office right now. And you should do that and get the kids' vaccines caught up, because what we don't need on top of a COVID outbreak is, I really don't need a measles outbreak. That would really be a hard thing for us to manage as well. Because keep in mind, there really is only so much hospital capacity at any given time in any state in the country. And we don't want a pertussis outbreak. We don't want outbreaks of these preventable diseases because, one, we know the morbidity and mortality of those is really quite serious. But it's doubly worse when it was preventable.
I know you're a very busy man, so let me try to get 2 last questions in here from Marcus. And this one we could kind of take and use. I'm going to use this in a couple different ways here. Can my team practice together without really risking any harm to each other by contracting COVID-19 outdoors on an open grass field? I'm going to add to that. And, you know, Memorial Day weekend is this weekend. You know, what risks should people know about in a field or for their children at the beach, out and about on this Memorial Day weekend? What risks should people be worried about?
Yeah, so Marcus, your question about soccer, I think the risk you run with playing soccer in particular is, for one, I don't know how you play soccer without getting close to other people. And part of what I'm getting at is it's a game that's mostly with your feet, but you do use your hands to throw the ball in. And so your hands are the portal that could spread the disease. I think the other thing I worry about is, when we're playing sports, you tend to be inhaling and exhaling much quicker. When you're doing that, you're much more likely, if you're an asymptomatic carrier, to be spewing a lot more viral particles. And you're not likely to be able to wear a mask while you're playing forward. So that's just to answer your question, Marcus. I don't think practicing soccer in your over 40 league is a good idea right now. As far as Memorial Day, the risk we run, I think the risk we run is this: if you're traveling with your members of your household and you're just together, I think your risk is pretty small. When you start getting in a crowd of people, then that's more concerning. I mean, the way I think about it this way, Ryan, is, I stay in my bubble. I have a bubble of 5. I got wife and 3 kids, right? We're a bubble of 5.
Don't forget the puppies.
There you go. I got Daisy and Rosebud too. But if I get out of my bubble, I risk getting into trouble. And the thing I just say about that is I want to stay a little bit in my bubble. So it's not just my 5, it's the same 5. You know what I mean? And it kind of one of the things I tell my kids is, stick with the same 5 helps us stay alive, And I do see these little things so we can all remember this. And part of what I'm getting at is I think it's really important when you do go out this weekend, if you do go out, stay away from crowds. If you're going into a store and they're, having a queue, stay 6 feet away from people as best you can. One of the things I'd say too, if you're going shopping, one of the things I don't do is I don't pick up an object, then look at it and put it back on the shelf, because then I might have put germs on there. So what I do is if I pick up an object, I go buy it. I figure well, I picked it up, I'm going to own it now. So I wouldn't pick up things and look at them anymore. I know that sounds like I'm being really picky, but I'm just trying to think of the little things I can do to protect everyone else, including, my family.
Rebecca asks, when salons open, you think blow dryers are going to be a risk? Obviously, can particles be blown around with a hair dryer?
Yeah, Rebecca, I think that's something we have to figure out as a state what we're going to do with that. I was actually on a call yesterday with Secretary Pryor from Commerce with some of the cosmetologists across the state talking about that very issue. And here's the rationale. It's possible. The one big concept is blowing air inside of a closed space could aerosolize particles. So we have to look at what the risk really is. And one of the things we have to evaluate for the state is it too big a risk for us to allow that to happen right now? And I think that's something we have to figure out for ourselves. But theoretically, it is a risk because, once you put a blow dryer around someone's hair, if they had viral particles, I'm not sure how they got them around their hair, but if they coughed or sneezed or whatever, they, touched their hand to their head, the viral particles could be there. And one of the things I think we're all a little bit conscious of is, am I the only one who notices how often we touch our face during the day? It's
I've been trying not to. Yeah,
it's hard not to, but it's interesting, how often we touch our face, scratch our head. And so you could see where viral particles, the way I think about it this way is, one of the things I'm doing is I don't know if you've ever heard the acronym or the word ham and eggs. Ham and eggs is a pretty popular breakfast for people. So ham and eggs is how I keep my own little personal infection prevention program for me. So I manage my hands. That's my H. I get hand sanitizer on all the time, making sure if I touch a common surface, I've used it, or if I touched a shared object, that's my H. It's my H for hands. Then for A, keep my arms 2 people arms length away. That's my A. For M, I manage my mouth, what comes out of it. Then for eggs, it's for the E is for entering and exiting a place. So I'm careful where I enter and where I egress. And then the last G I have is groups. I keep back to my group of 5. And I give you that ham and eggs approach just because sometimes I think the pandemic gets so broad-minded. It's how do I even do all this stuff? But I think that acronym, that mnemonic, if you will, ham and eggs, it helps you kind of contain your response in your personal infection prevention plan.
And just to wrap up here, I know you are busy. If you had one thing that you could magically make every Rhode Islander know about COVID-19, or one thing that you can make every Rhode Islander do regarding COVID-19.
Look forward to something is my main thing. Find something to look forward to. And part of why I'm just saying is your emotional well-being is important to the Department of Health. So find something to look forward to. So one of the things I'm looking forward to, Ryan, is I was on a little bit of a search. I live in North Kingstown.
Oh, you're right across the bay.
Right across the bay, my friend. And I was actually really happy in North Kingstown with Mateo's Bakery. They sold the best cannolis I've ever had in my life, right? And they moved to Tampa, which really broke my heart a little bit, right? So one of the things I am on right now is a search to find the best cannoli in Rhode Island. So one of the things I look forward to is getting to a point where I can travel across the state now to sample some of the better cannolis this fine state has to offer. So what I'm just saying to everybody is find something fun that you can look forward to that's not going to hurt you or hurt anyone else. And I think that can be kind of a little bit fun to do as a family too sometimes is what's one fun thing I can look forward to? And for some people it might be, I want to hike all the mountains of New Hampshire. That is another great thing to look forward to. But for others, it might be, I want to spend more time with my family and actually do this kind of behavior where I actually connect with people. But I think if you find one thing to look forward to, it can really just elevate your mood a little bit and give you a little more perspective on this whole pandemic.
Excellent. Doctor, did we miss anything today? Anything else out there that you would like to get out?
Oh, you covered all the bases, my friend.
All the easy bases, right?
Well, I appreciate you doing that, and thank you so much for being part of the response to the pandemic.
Of course, and we will talk to you soon. And good health to you continued, and we'll see you out there soon.
I hope so. Thank you. Bye-bye.
All right, so that was Dr. James McDonald from the Rhode Island Department of Health. And for more information, of course, you can visit health.ri.gov/COVID. That's going to do it for us today. We'll catch you next time.